Let's take healthcare. About 95% of our plans are similar. We both set up a government plan that would allow people who otherwise don't have health insurance because of a pre-existing condition like my mother had, or at least what the insurance said was a pre-existing condition, let them get health insurance. We both want to emphasize prevention because we've got to do something about ever-escalating costs, and we don't want children who I meet all the time going to emergency rooms for treatable illnesses like asthma. It is true we've got a policy difference because my view is that the reason people don't have health care, and I meet them all the time, in South Carolina, a mother whose child has cerebral palsy and could not get insurance for it and started crying during a town hall meeting. Hillary, I'm sure, has had the same experiences. What they're struggling with is they can't afford the health care. And so I emphasize reducing costs. My belief is that if we make it affordable, if we provide subsidies to those who can't afford it, they will buy it. Senator Clinton has a different approach. She believes that we have to force people who don't have health insurance to buy it. The last point I want to make it has to do with how we're going to actually get this plan done. You know, Ted Kennedy said that he is confident that we will get universal health care with me as president, and he's been working on it longer than I think about than anybody. But he's gone through 12 of these plans, and each time they have failed. And part of the reason I think that they have failed is we have not been able to bring Democrats, Republicans together to get it done. That's what I did in Illinois to provide insurance for people who did not have it. That's what I will do in bringing all parties together, not negotiating behind closed doors, but bringing all parties together and broadcasting those negotiations on C-SPAN so that the American people can see what the choices are. Because part of what we have to do is enlist the American people in this process and overcoming the special interests and the lobbyists who are, Senator Clinton is right, they will resist anything that we try to do. My plan, her plan, they will try to resist. And the antidote to that is making sure that the American people understand what is at stake. I'm absolutely committed to making sure that anybody in America who needs health care is going to get it.